And just like that, we are back.
Yes, welcome back to Navigating the Periphery. We've established who we are, and if you like what we're doing on our channel, you guys know what to do. So in part 2, today we're going to navigate the periphery of how patients with serious mental illness were treated here in the past in the United States. And we hope you enjoyed last week's show on Letchworth Village here in New York. Now we will delve more into the treatment history of patients with complex mental illness. So now, on with the show. Philip? Take it away.
Individuals have experienced mental illness since the beginning of time. Overwhelming anxiety, depression, traumatic early life experiences, or psychotic disorders have always been a part of every society. Because mental health disorders do not discriminate, meanwhile, various treatments have sought to address mental illness from more barbaric and ineffective methods in earlier centuries to more humane and effective treatment methods in modern times. Has that meant that the prevalence of mental illness has changed over the centuries? And if so, how? So for the month of October, here's where the horror begins.
Wow. The first efforts to treat the mentally ill were often barbaric and unforgiving. Mental illness was often viewed as a religious punishment or associated with demonic possession. Treatments before the 17th century included trepanation, bloodletting, and purging. Trepanation was one of the earliest known treatments for the mentally ill. The practice began about 7,000 years ago and was implemented by removing part of the skull using an auger or a saw. The practice was used to treat headaches, mental illness, and demonic possession.
Little evidence of this practice remains, so not much is known about it. Rooted in Greek medicine, bloodletting and purging gained popularity during the 1600s. The English physician Thomas Willis developed the process of bloodletting and purging based on the belief that there is a relationship between internal imbalances and mental illness, and that bleeding, purging, and even vomiting could correct those imbalances and heal mental disorders.
Well, that was a little disturbing. Isolation was the preferred treatment of the mentally ill at the beginning of the 18th century. It was common belief that the mentally ill were dangerous and should be kept away from society and hidden from their families and communities. Sadly, this stigma surrounding complex mental illness still lingers to this day. Asylums became widespread during the 1700s. Such institutions were often inhumane, not to mention overcrowded and unclean, and this continued through the 19th century.
Treatments within asylums were barbaric and often caused physical harm to the patient with little to no relief of their symptoms. Confinement was a popular treatment for patients who were experiencing a nervous breakdown. Confines included straitjackets, chains, and the horrifying cage. This inhumane treatment required the patient to be placed in a narrow and cramped cage. The patient would be locked in the cage for hours until they were sedated. Once they were calm, they would be removed from the cage. The rotating chair was also a popular treatment in the 1800s for the mentally ill. It was based on the belief that spinning to induce vertigo would cause a purge through nausea and vomiting. The intensity of the rotation was based on the level of mental illness the doctor was treating.
Wow. In the 1940s and 1950s in the U.S., the treatment of mental illness was far less advanced and humane compared to modern practices. This era was marked by significant shifts in psychiatric care, but the overall approach remained heavily reliant on institutionalization and invasive treatments. Here are some of what the major trends and treatments were during that time.
Lobotomy was once considered a miracle cure for mental health issues. It was a highly traumatic brain surgery carried out by inserting a sharp instrument in the brain to sever certain neural connections.
Ow.
It was once believed that such surgery cured depression, schizophrenia, and personality disorders. Although this treatment did appear to help some who had mental illness, it also was considered inhumane and ineffective. It also left many patients with irreparable brain damage. One of the biggest cases in the media regarding lobotomy was Rosemary Kennedy, the younger sister of President John F. Kennedy. When she was 23, her father scheduled lobotomy without telling his wife. The procedure had disastrous consequences, leaving Rosemary with the mental capacity of a toddler.
That's sad.
Yeah. Following the lobotomy, the Kennedy patriarchs sent Rosemary to live in St. Coletta's, a Catholic facility for the mentally disabled in Jefferson, Wisconsin, where she lived for 6 decades until her death.
Well, then came something a little less horrifying: electroshock therapy. This was first used in the mid-1900s to treat mental illness. It was a scary treatment not only for the patients, but for the doctors as well. Electroshock therapy was used to induce seizures, which in turn was believed to relieve mental illness, a sort of mental reboot. Early use of electric shock therapy was considered unsafe because the amount of electricity coursing through the patient's brain was enough to cause death. The study of electroshock therapy led to a better understanding of how to properly administer the treatment, so that today it is much more effective at treating various mental health conditions, with much fewer side effects. It is also known today as electroconvulsive therapy, or ECT.
The development of certain drugs to treat mental illness gained prominence in the mid-1900s. A major breakthrough occurred with the introduction of antipsychotic drugs, the first being Thorazine. It was the first effective pharmaceutical treatment for psychosis, particularly schizophrenia. While these drugs helped reduce the need for some of the more invasive treatments like lobotomy and electroshock, they also came with significant side effects. Before the development of more targeted psychotropic medications, sedatives like barbiturates and tranquilizers were commonly prescribed to control symptoms of anxiety, agitation, or insomnia. These did little to treat the underlying mental illness, but often kept patients docile. And in an institution, docile is better than hyper and all over the place.
During this period, mental illness was highly stigmatized, and there was a general lack of understanding about the causes of mental health disorders. Many conditions, including depression and anxiety, were often seen as moral failings or character flaws rather than medical conditions. Families of those with mental illness were often ashamed and would send relatives to institutions far from their home. There was also significant fear around mental illness, leading to further isolation of patients.
The mental health treatment landscape in the 21st century has greatly evolved and has given patients a wide variety of options, including many types of medications and therapies. As the understanding of mental illness continues to develop, so do the methods for treating it. The stigma surrounding mental health disorders has diminished somewhat in modern society. This has paved the way for those suffering to seek help, which is more readily available and much more humane than previous efforts at treating those with mental illness.
According to statistics published by the Center for Disease Control and Prevention, or the CDC, in 2020, 20.3% of adults in the United States had received mental treatment in the previous 12 months. This statistic reflects a growing awareness and use of mental health services among adults, including therapy, counseling, and medication. So, Philip, how do you feel about how your condition would have been treated in the 1950s?
Well, Mom, it was scary as hell.
I would say so. We hope you enjoyed these last two episodes. They've been very troubling, and I'm so glad that they made so many strides in the psychiatric and pharmacological fields, as well as psychiatry and therapy.
These last two episodes have been very troubling, and I'm so glad such strides have been made in the psychiatric and pharmacological fields, as well as psychology and therapy.
Me too. It was a very eye-opening episode. Thank you for doing all the research for these two episodes. It was really great.
No problem.
And just in time for Halloween. We hope you guys enjoyed these two episodes. It was a departure from our usual format, which was fun.
Yes, it was. Back to our normal format. Always remember, it's okay not to feel or be okay all the time. You guys and gals are not alone. We're here.
Yes, and that we're trying to stop the stigma of a mental health diagnosis, one show at a time. So until our next episode, coming really soon, we hope you enjoyed these two episodes, especially during Halloween. The footage was a bit spooky. If you haven't seen the last episode on Letchworth Village, part 1, we will leave a link to it in the description box below.
Yes, spooky.
So everyone, I hope you guys have a happy Halloween.
Yes, have a very happy Halloween and a good October.
Yes. Take care, and bye for now.
Bye!